So the Ambassador study is a randomized phase 3 trial of adjuvant pembrolizumab versus observation in patients with muscle invasive urothelial carcinoma. The study design included patients with muscle invasive urothelial carcinoma. This is a multi-center open label phase 3 randomized trial. The key eligibility included patients with muscle invasive urothelial carcinoma of the bladder, ureter, urethra, and renal pelvis. And patients must have had surgery, radical surgery within 4 to 16 weeks, and they could have persistent muscle invasive disease if they received neoadjuvant chemotherapy. It must be PT2 or greater, positive lymph nodes, or positive surgical margins. And if they did not receive neoadjuvant chemotherapy, then they had to be at least PT3 or greater, positive margins or positive lymph nodes. The study stratified by pathologic stage, PD-L1 status, and whether the patient received neoadjuvant chemotherapy. The patients were randomized to receive pembrolizumab for 1 year versus observation, and the trial was designed with a dual primary endpoint of disease-free survival and overall survival, and the secondary endpoint of PD-L1 status, and looking at disease-free survival and overall survival. So 702 patients were randomized to receive pembrolizumab versus observation, and the study was well balanced. We had about 2/3 of the patients receive neoadjuvant chemotherapy. Greater than 50% of the patients had lymph node positive disease. There was a small number of patients, about 2.5%, that had positive margins, and greater than 50% of the patients were PD-L1 positive by central testing using the combined positive score of 10% or greater. There was a small number of patients, about 15% of patients, that had mixed urothelial histology with variants, excluding small cell. And we didn't limit the number of patients with upper tract tumors that could enroll. So we had about 20% of patients with upper tract urothelial carcinoma that enrolled. So the study met the primary endpoint of disease-free survival with a median disease-free survival of 29 months for patients that received pembrolizumab versus 14 months for patients in the observation arm, with a hazard ratio of 0.69 and a median follow-up of 22 months. We also looked at the subgroups, and we saw that almost all subgroups benefited with adjuvant pembrolizumab. The subgroup of upper tract urothelial carcinoma was small, and the magnitude of benefit is unclear. So we think we need to further explore this group. In terms of the second primary endpoint of overall survival, the data is not yet mature, but we did present the interim results, and this did not meet the primary endpoint of improvement in overall survival at this point, with a hazard ratio of 0.98. But the data continues to mature, and more events are needed for the final analysis. Well, the study was positive. Adjuvant pembrolizumab demonstrated a statistically significant and clinically meaningful improvement in disease-free survival versus observation in this high-risk patient population of muscle-invasive urothelial carcinoma, regardless of PD-L1 status. And the overall survival endpoint continues to mature. These results support adjuvant pembrolizumab in this setting, in this adjuvant setting, as a new therapeutic option for patients with muscle-invasive urothelial carcinoma. Additional follow-up is ongoing for the disease-free survival and the overall survival endpoint. And we're also doing ctDNA analysis using two different platforms, the Signatera and the Foundation One Tracker, along with additional correlatives. So we look forward to presenting the updated data once this data becomes available.